first thank Jay, GQ, and Joe for this great opportunity to speak here. And also, I'm glad to see he's expanding or extending the horizon to including some of the vascular talk, because I'm probably a few vascular people here. And I guess my job here is to try to convince you that the blood vessel is as important, if not more important than the heart, because if you may recall, this morning in one of I think it's Dan Gary's slides, is blood vessel is the one connecting the heart to the rest of the body. So, oh, here. Okay, thank you. I think we got it. It's showing? Yes. Okay, great. My talk, I've been working on the vasculature with a specifically interest in smooth muscle cell. And I want to show you some of the work we've been working on, and some of those will be very unpublished data. So to convince you, your blood vessel is very important. And actually, this has been recognized maybe over 300 years ago by this old saying, is a man is as older as his arteries. So I also found these pictures to try to kind of show you why the biologic agent and your vascular agent may be different. But importantly, if you look at these two different people, and whatever you have in the blood vessel, I think determines the aging process. When you look at the blood vessel, here, I'm sorry, this slide's supposed to be, aging, as we all know, is a very independent risk factor for many diseases, including cardiovascular disease. And it's shown here in the red. This is the cardiovascular incidence with age, and also which is associated with the death. So this data definitely convince you with age, you got more incidence of deaths. So that's an independent risk factor. So what happened in the vasculature actually is when you look in the young arteries versus the old arteries, there were a lot of molecular cellular changes and then remodelings going on. And one of the areas we've been focused on is in this intermediate media area. That's what happened mostly with aging, is the changes including endothelial dysfunction. But what we've been focused on, smooth muscle change, that includes smooth muscle proliferation, migration, and the matrix deposition in this area, and the senescence. So what happened after these changes is you're seeing a lot of intimal thickening. That's the evidence. And the media thickness. And the result of the changes is a functional arterial stiffness. And with further development of this, and that becomes cardiovascular disease associated with aging. That's why we see a lot of cardiovascular disease in old people, because all these changes from smooth muscle, the cellular level to the organ level, and eventually all these pathological conditions. What we've been focused on in the past few years is mostly vascular calcification. One of the reasons we're interested in this is increased prevalence in age. You may not recognize, because we all believe calcification is a passive deposition previously. Now we recognize that calcification is actually a positive, active process of the vascular cell changes, their phenotype, from especially for smooth muscle cells. They are contractile, proliferate, but they can undergo dedifferentiation and transdifferentiation into a more like bone-like cells. So in recent study, especially those epidemiology study have shown, calcification actually happened in the mid-age or even younger age people. For example, between 30 to 39 years old, this age group, that's already 11% of men have calcium deposition in their vasculature. But women is a little less. But in the next age group, that number goes up, even doubled. So that's why it's not a passive deposition, it's active change with the age. And of course, a lot of disease conditions accelerate the process. You see a lot of calcification in patients with atherosclerosis, diabetes, and renal disease. But the problem is there's no treatment. All the treatment here is for underlying disease conditions. So you may have heard stents. That's what's being used to improve the condition. So this calcification in this coronary artery from patient. And that helped to improve, to open the lumen, to improve the blood flow. However, you see what happened here with the stents is smooth muscle cell proliferation, and eventually that leads to restenosis. So this patient died like 2 years after put the stents in. But the problem here, that did not improve this condition. And if that didn't work, so the next strategy is replace that artery. But what you're seeing here is, again, normally we put a vein into the position where the artery is supposed to be, and the vein, usually they do not calcify. But what you're seeing here, when the vein is put into artery condition, so they start to calcify. So that did not solve the problem. So we have to go back to understand what's the mechanism and how we can use the basic science knowledge to improve therapy. So over the years, we've been trying to understand what's the mechanism for the smooth muscle cell become a bone-like cells. And then one of the transcription factor we have confirmed, and we use different strategy, is the transcription factor called RANKS2. That's critical for the smooth muscle cell to become a bone-like cell. What you're seeing here is using different system, this smooth muscle cell culture, and this is ex vivo ring culture from the mouse artery. We cut it small rings. And this intact animals, we feed them high-fat diet to induce. All this red staining, this brown, is calcification. But if we delete RANKS2 in smooth muscle cells, either in smooth muscle cells specific RANKS2 knockout, we were able to block calcification process. So demonstrating RANKS2 is one of the key factors in smooth muscle cell, driving the transcription regulation and make the smooth muscle cell to become a bone-like cell. And other studies also, this is a different smooth muscle specific knockout animals generated by Dr. C.C. Kelly's lab, also confirm that when you delete RANKS2, and this is by different strategy, but still in smooth muscle cells, that can also inhibit calcification in animals. So based on all this, then we definitely confirm smooth muscle cell express RANKS2 is very critical for the calcification process. But you remember when I mentioned the age-related cardiovascular symptom, in addition to calcification, another factor that's very important, and that you see, is atherosclerosis. So we were interested to know whether RANKS2 in smooth muscle cells, when we delete it, can affect atherosclerosis. So this is chow dye compared to chow dye, and high-fat dye compared with high-fat dye. Definitely, when you delete RANKS2 only in smooth muscle cells, that block calcification, and on top of that, also block development of atherosclerosis. So that's another evidence that RANKS2 deletion may be inhibit aging related to disease condition. Another model we use is this injury related near intimal formation model. That's what you often see with the PCI, the injury, and then cause endothelial dysfunction, then restenosis happen. That's the model we use. Again, with RANKS2 knockout mice, we saw inhibition on the neointimal formation. So with all these pathological conditions, what we found is, associated with age, is neointimal formation, atherosclerosis, and the calcification. If we block RANKS2, we were able to inhibit the pathological condition. So we were wondering, what's the role of RANKS2 in vascular aging? So definitely, it seems that it's connecting all this pathological associated with aging. Then we go back to look at the young and aged mice. What you see here is 2-month-old artery from the C57 black mice, and this 18 months older. If you look at the RANKS2 expression, apparently it's dramatically increased. And then we were able to confirm with different kind of time-dependent increase of RANKS2 in the mouse arteries. And then, if you look at the old arteries, you will see a lot of thickness. That's one of the symptoms with aged mice. And another thing is you see a lot of red staining. This is matrix protein deposition. That was associated with the aortic stiffness of the animals. This is, we use pulse wave velocity to look at the flexibility or stiffness. Apparently, that's dramatic increase with age. Then we want to know if that RANKS2 involved in regulating the matrix protein process and how that could relate it to this aged arteries. As you can see, the old versus young animal, you definitely see a lot of changes and increase in these matrix proteins. And when we look at the RANKS2 knockout mice, apparently the same proteins were inhibited. And then we go back to look if the deficiency, whether this matrix protein can be affected in the real mouse arteries. Again, this real-time PCR confirmed that increase of RANKS2 and the matrix protein in the old arteries, but that was inhibited while we block RANKS2. So one of the phenotype we found in this smooth muscle specific knockout is at the basal level, if we knock out the smooth muscle cell RANKS2, that did not affect the development of mouse or the development of the artery. And if you see the changes, expression of the smooth muscle markers, that's similar. And also, if we look at the structure, that's similar. So at the basal level, either in animal models or in human, RANKS2 expression in the artery is very low. However, in the aging process, in disease condition, RANKS2 expression is going up. So over the years, we've been trying to understand what are the factors cause RANKS2 to go up. So because of time, I just want to use in this slide to summarize what we have found is mostly one of the key factors that increase RANKS2 expression is oxidative stress. So with this as a model system, we were able to show increased oxidative stress induced AKT activation. That leads to increased RANKS2 trans activity. So this is a transcription factor that induces a lot of gene expression related to bone cells. And also another model we use in diabetic condition is increased glucose that can cause increase of protein modification by all glycosylation. So that were modified on AKT. And instead of inhibiting AKT phosphorylation, we found this specific modification by all glycosylation increased RANKS2, AKT activation by increased phosphorylation. And downstream of AKT, we found is the FOXO phosphorate by AKT that leads to FOXO nuclear export that inactivates these transferrin cofactors that block the expression of E3 ligase. And that E3 ligase is the one key factor that binds to RANKS2 that causes to RANKS2 ubiquitination. So that's why with time continues, RANKS2 expression sustained and keep that level. And another factor is RANKS2 is a transfactor that regulates the expression of itself So that's why over time, RANKS2 going up. And I think another factor we have seen is P32 MAP kinase can be activated by oxidative stress. That also leads to increase, that binds to RANKS2, increase RANKS2 transactivity. And when we block this biopharmacological inhibitors or shRNA, we were able to block RANKS2 upregulation. And recently, we also found dietary potassium that's critical to inhibit RANKS2 function in smooth muscle cells. That inhibit smooth muscle RANKS2 expression that improve the atherosclerosis related to calcification in the arterial stiffness. So with that, I want to summarize what I've just told you is RANKS2 play a central role in regulating age-related vascular complications, including calcification, atherosclerosis, and near-intimal formation. And a lot of factors that contribute to the upregulation of RANKS2 with age is oxidative stress, hypoglycemia, and the signaling pathway involved, including AKT, is the key signaling pathway we found, and also P38 MAP kinase contribute to RANKS2 upregulation that leads to smooth muscle calcification. And then downstream RANKS2 can upregulate matrix protein, which I believe is the key factors that's driven this aging process. So any strategy to reduce RANKS2 that could be effective to prevent vascular aging and calcification. So with that, I want to thank those people. You have some of them, you see the pictures here. Yunsin was the driving force for all this, and my graduate student, Chang Han Ban, did a lot of work on the early RANKS2 smooth muscle knockout, and my collaborators over the years and funding support. Thank you.
I think we have time for one question.
Lovely presentation. So RANKS2 appears to be mediating vascular aging in part by increasing, RANKS2 increases vascular smooth muscle cell calcification, proliferation, generation of extracellular matrix. There's also evidence that vascular smooth muscle may transdifferentiate into foam cells. So, and you did show us that the RANKS2 knockout mice had fewer fatty atherogenic lesions.
That's right, and I didn't have time to talk. Is what we found is when RANKS2 is upregulated in smooth muscle cells, it also is a transcription factor that regulates a protein called RANK ligand that act as a chemoattractants, which can pull the macrophage into that area, to the vicinity. So we published that paper in Circular Research in 2012, I believe. That macrophage come closer to the smooth muscle area. That's how we were able to, when we block RANKS2 in smooth muscle cell, the macrophage is still coming to the lumen, but retained in the endothelial layer, didn't infiltrate into the intimal. Thank you, that was a great question.